Yes, it has to be one.
Hi, my name is Kristen, and I'm going to be doing my video validation for my head-to-toe assessment. I just received a change of shift for a 32-year-old male, John Hunt, admitted on 11/21/2014. Earlier this morning, fell off of his bike. Patient complains of hurt wrist. It's been stabilized. The vitals are all within normal limits, and he was administered 650 milligrams of acetaminophen 30 minutes ago. I'm most concerned about this patient's pain and circulation in his right wrist. Also want to assess the patient for potential head injury. The x-rays are being evaluated now, so I'm going to go in and do my head-to-toe assessment.
Come on in.
Mr. Hunt, can I come in?
Please.
Hi.
Hey.
I'm Kristen. I'm going to be your student nurse. I'm a student RN from USF. How are you doing?
Good.
Good.
Doing okay.
Good.
I've been worse.
You've been worse? Okay. All right, looks like everything's set up here and everything's working and the room's clear. Let me just wash my hands real quick. I got everything I need. I just wanted to check in, mainly wanted to see if that acetaminophen is working for you. You were your pain was an 8 out of 10 earlier. What are you at now?
It's about a 3 or 4 now,
Oh,
so
great.
it's a lot better.
I
think it's working. I don't think I need anything else.
Okay, excellent. So what I'm going to do today is a head-to-toe assessment. What that is just kind of an opportunity for me to go over all of your system and make sure everything's working properly. Is that okay?
Yeah, that's fine.
Okay, it should take about 15 minutes. So
okay.
Let me put on some gloves. And first things first, I'm just going to grab a set of vitals.
Okay.
So let's just look at the wrist. Okay, and it's all stabilized and everything's good with that. And just kind of checking, can you feel my fingers?
Yeah.
The cap refill looks good, so that was kind of my primary concern, is just the circulation in the hand. Okay, so if it's all right, I'm just going to get your oral temperature.
Yeah, that's fine.
And basically I'm looking for an oral temperature between 36 and 38. Put this under your tongue, please.
Okay.
Okay, 37.5, excellent. And it's always good, it's a closed fracture, but good to know that there is no signs of a fever infection going on. I'm going to get your blood pressure. I'm going to actually slide over here and get it on this arm since you have a hurt arm. Okay. And I looked at your chart. It looks like you were seen about a year ago and your blood pressure was normal. It was 120/80, so hopefully I'll be getting something similar to that.
That's the most important. That's the most important.
Before it was that we required a
you
doctor
can listen to
sign off.
bronchodilator, but just say the ratio.
They're saying we're wise enough to make the right decision whether something's out of the scope of our practice and we need to go to
Normal,
a physician.
normal 2 to 1.
But
when did that change?
And then remember, patient needs to sit up and you have to look back. Listen to the back. Okay? It's over here, just anterior posterior.
because the PT law in many other states, they've already had California is one of the big ones that even get.
Okay, and it's just going to get tight real quick.
Just start like, now that I'm back.
Yes, but you really blacked out enough to
All right, 124/84, so that's within normal limits. All right. So I'm going to go ahead and write that down.
No, you are correct.
And this is all going to be charted later.
Honestly, I'm just doing it for your benefit, but you would ask.
Okay, and so now I'm going to put the O2. Ooh, I need your O2 stat. Is there one in here?
You said bronchial vesicular.
Okay, so I'm just going to put this on right here. and you don't have any nail polish, so good to go. And the red sensor goes atop your nail, and then that just lets me know that your alveoli and your lungs are making an exchange. And it looks like you are a 99%. All right, great. And now I'm going to
So start over again by saying now that I inspect.
check your respirations and your pulse.
1, 2, 3.
So I'm just checking your pulse for a full minute, and I'm over at the radial point. And a full minute's gone by, and his pulse is 60, and his respirations are 18. And later I'll listen to your lungs and give a more clear evaluation. Okay, so we have all the vitals done. And I'll just work over here, that's fine. So starting with your head, I'm just gonna ask you a couple of questions. Is it okay if I call you John, or do you want me to call you Mr. Hunt?
Mr. Hunt, please.
Okay. And actually, can you verify your birth date for me, please?
August 3rd, 1982.
Okay, and that matches my records. And the last 4 of your social, please.
4424.
Okay, thanks, John. And John, I know these questions may be a little redundant, but would you mind just telling me your name and why you're here?
Sure. It's John Hunt. I'm here because I fell off my bicycle.
Okay, and do you know the date?
Yeah, it's November 21st, 2014.
Okay, great. Okay, perfect. And now if it's all right, I'm going to just chart that as ANO times 4, and I'm just going to go ahead and start with your head. I want to make sure there were no injuries, so if you would mind to just lean forward for me.
Okay.
Okay. And I'm just looking for anything abnormal, deformities, contusions, abrasions, penetrations, anything like that. I'm also looking at the ears and the symmetry. There doesn't seem to be any cerebral spinal fluid or blood coming down from the ears, the hair, and no sign. I mean, this is a mobile patient, so no signs of any pressure ulcers. And the back of the neck looks good. And the fontanelles seem to be appropriate, so no sign of dehydration or increased intracranial pressure. Okay, and then if it's all right, I'm going to check your pupils. Okay, so if you can just...
Yeah, what are you going to be checking for? Is it going to hurt?
Nope, it's not going to hurt at all. I just want to see that there's symmetry with your eyes, that there was no brain injury, and that your pupils are round and they react to light at the same time. Okay, so just
sure.
Everything's perfectly normal. I'll dim the lights, and then I'm just going to come in like this. Okay, and that looks good. So that's Perla, pupils round, reactive to light. And then I'm also just, while I'm on the eyes, I'm just checking the sclera and then the conjunctiva. And that looks good, and it's white, and everything's healthy. And then if it's okay, can you just breathe in through your nose and breathe out? Okay, and I'm just gonna look, and it looks like there's a patent airway there. And then in your mouth, just say ah for me. Looking at your tonsils, look good. They don't seem to be swollen. Your teeth are all good. No chips from falling off your bike. And then underneath here, and I'm looking at the color of the mucous membranes, and they appear to be wet, so I don't think you're dehydrated. Lift up your tongue. And I'm looking for symmetry with the tongue too. It's a good way to rule out strokes. Smile for me. Okay, good. And then if it's all right, I'm just gonna go ahead and palpate the carotid artery, never at the same time. Okay, good. It's not bounding, very normal. And here as well. And then also just kind of assess the lymph nodes here. And those also don't appear to be swollen. Okay, and then looking at the neck, would you mind just turning your head this way? Okay, and then this way. All right, and I'm not seeing any signs of jugular vein distension. You know, young patient here, looks pretty healthy, so I'm not expecting any heart failure, but good to rule it out. And I'm looking here at the chest and the color and the temperature, just touching him feels good. And then I see your clavicle here like this, there's symmetry. And I'm gonna come down now and I'm gonna do a little bit more of a detailed assessment of your heart and your lungs, if that's okay. So I'm first gonna listen to your heart, and what I'm listening for is not just the rate at the apical pulse for a full minute, but the rhythm and is it bounding, is it diminished, and then I'm also listening for murmurs. So starting over on the right side, I'm going to go to the second intercostal space, and I'm listening now to the aortic valve, and now the pulmonic valve, and then I'll drop down, and I'm here at the herbs point, and then one below that at the fifth intercostal, mid-sternum, I'm at the tricuspid, and I'm listening here for a murmur or any swishing, and I'm not picking up on any. And then is it alright if I just drop this down a little bit? And then I'm going to go under here to the fifth intercostal mid-clavicular line, the point of maximal impulse for a full minute, and I'm picking up the heart rate. And it's very regular, but I'm going to listen.